Hi, I'm Rahul Khanna. I'm the country manager for Paramount Bed Japan in India. Paramount Bed is a Japanese MNC. We started operations in 1947 and we are operating in 100 countries across the world. We have various factories across the various locations in the global arena in Japan, China, Indonesia, Vietnam, Brazil. And in India, we started our own assembly and manufacturing unit last year. This company started in India in 2013 as a 100% subsidiary of Paramount in Japan. As we all know that the hospital bed segment is not a very thought after or sought after segment in the country. Still, I have seen in tier 2 and tier 3 cities, hospital beds are being considered just as a four-leg cot. But since the transition is happening in India, people are now considering hospital bed as a medical device because of the features and benefits it provides to the patient and the caregiver. That concept is now coming into India, and people have started considering hospital bed as a medical device, which is one of the major changing factors in this particular segment. Paramount Bed Japan has got expertise in this particular portfolio since last 70 years. So when we started operations in India last five years back, the, the main concept was to launch these high technology beds which provide the comfort and the features and benefits which can give support to the patient, not only in aesthetics part, not only in the comfort part, but also the early rehabilitation part. So the prime focus of this company from the day one was to launch the concept of early mobilization, early rehabilitation in the country, and to bring in the product line which can be really successful in this country. India being a very wide and large, diverse country, in my experience, I've always seen the accessibility, the quality, and the cost. These are three major parameters which help our product to establish in this country. So our vision from the day one was this, that if we can provide a good quality product, being a Japanese quality, at an affordable cost and reach to the mass markets. That was the vision, and because of that vision, Paramount Bed Japan started its 100% subsidiary in India. For first 3 years, we were just importing the product line and then supplying it to various customers. We started our operations on our own with having our own sales force, service, logistics, and a complete backup support from Paramount. We got a very good response from the market, and from that point onwards, then we started our own assembly unit. We started assembling our beds in India and provide the global quality at a local cost, and to reach to the mass market into the motorized bed and the manual bed segment. So that's our vision, and from there we are now moving forward towards the concept of early rehabilitation. We are launching beds which are very high-end, used in critical care as well, which provide early rehab to the patients. So that is one pair. For that, my colleague Mr. Dagashiva-san is here in India to launch that particular product, which is help for early rehabilitation. So if you ask me, Paramount Bed Japan is a one-stop shop for any hospital. We can provide you a bed ranging from 25,000 rupees to 25 lakh rupees. So that's the range what we have. Not only in terms of beds, but stretchers, recliners, carts, LDR beds, and to provide the good quality, aesthetics, and the comfort and the features to the patient and the caregiver.
The bed market is also in the hands of a highly fragmented, unorganized segment. How do your prices compare, and how does the customer, does he understand the quality difference, or is there a quality difference? Just talk about your product. You have gone very far in the assembly, so your product vis-a-vis, and how will the tier 2 and tier 3 demand look at it?
See, if you see the overall hospital bed market, it is divided into three segments: very high end, mid end, and the low end. Primarily, if I see the market, I mean, as you said, it is a very fragmented market. Yes, I agree. There is no concrete data which is available in the market. What my analysis, talking to peer group, talking to the industry experts, what I could gain is the total market size is roughly around 800 crores, which includes very high-end beds to very basic one crank bed. If you see that in a if this 800 crore business is, if you divide come if you try to bring it down to the number of units, that is roughly around 1,20,000 units of beds which are being used, which are being used in India on an annual basis. So the market size for a high-end bed is roughly around 40%. Then another 30% is for the mid segment and remaining for the low segment market. As I said, in tier 2 and tier 3 cities, there is a transition happening. People are transiting from a manual bed to a semi motorized or a fully 3-motor bed or a 4-motor fully motorized bed. So the market is huge. People are accepting that concept, people are accepting that change. But yes, in the entire market, as I said, in mid segment, low segment, there are a lot of local players, there are a lot of Chinese players. There were, unfortunately, there are not set protocols in the country in terms of hospital beds. So, I mean, the people use very low quality products. They just try to weld some steel rods and try to just put a mattress and then give it as a bed. So, I mean, definitely there is a huge difference in terms of quality, in terms of aesthetics, in terms of overall features which are really required in a hospital bed. We, as a Paramount Japan, we believe in the technology, we believe in quality. Not only us, there are other branded players also which are available in the market. They also provide some good quality products. But unfortunately, what is happening in this segment, just to bring down the cost, a lot of other branded players, what they are doing is they are trying to get it assembled in China, Taiwan. I don't say that China or Taiwan is bad quality. What I am trying to say is to bring down the cost, you start compromising on the components, the parts which you use in the bed from these countries and try to start selling it in a country, and then the quality of the product definitely makes a lot of difference. What we do is we use all the components which are in-house, which are all guaranteed and approved by the R&D team of the Paramount Bed, and then only we go ahead with the product. We try to use the best of the components which are available in the global market, so that we can give some extended warranties, and we can confidently put a brand Paramount on the bed. So now people have started understanding that. I would say 3 years, 4 years back, there was a big, inflow of Chinese beds in the market. People have started realizing that, I mean, these beds just last for a few months or 1 or 2 years, and then there is no service backup, there is no quality assurance. So then what is the use of going for those beds? So definitely now people have started realizing the fact that they need to buy some good quality branded product, which is now, there is a lot of acceptance for that, and people are started following that. So we are gaining the market share because of the quality, because of the after sales service, and wherever we sell, wherever who are our customers, the main business is the repeat business is also coming to us. So that is also becoming a big business for us. So as you rightly said, that yes, there is a huge quality difference in terms of quality of Chinese beds or local branded beds or imported or good quality beds. So that is there in the market.
So we as Stools are primarily displaying two of our latest innovations for the hospital industry. These are two separate verticals, one primarily dealing with indoor air quality, and the unique feature we have is air purification together with air handling, which is something which is very new for the Indian healthcare industry, but also a necessity today with the kind of outside air quality what we have. The other product which we have on display is our compact server room, which is a must in all the hospital environments. There are multiple departments where there is localized needs of servers and racks to be present. In the future, there would be more of the computer-aided surgeries or operations taking place, and this would need real-time monitoring of the procedures to help assist doctors. And compact server rooms is here for the future, and this is what we've introduced specifically in India for the first time for the hospital industry. And we believe this has a very long way to go, with a lot of benefits both from the hospital doctor's perspective to get the operations done, and also from the patient's perspective to have a much better outcome of the procedure. Regarding the future of the what we see as the future, I mean, our products, being a subsidiary from a German company, our products have always been technology leaders in our domains of businesses, and so is it the case with hospital segments. Both the products what we've introduced primarily are products which are futuristic in technology. So whether it is indoor air quality with our air purification products, or whether it is our compact server room product offering, this is something which will over the period of time kind of become a norm, and it will be a necessity, and all specialized hospitals and all kind of high-end infrastructures would ask as a demand these kind of technologies. So yes, going forward, I think today the technology is new, and the technology is futuristic, but I mean the future is not so far. I mean you will see it very soon as a mandate.
Thank you. There's a lot of positive things happening in India in healthcare with Ayushman Bharat and new things taking off. Philips as an organization is very positive towards the changes happening in India, and as an organization globally, we are trying to take a solution route where we are trying to understand the customer pain points and provide them a solution. This healthcare transformation services and infrastructure advisory division of Philips, which has started in India around 3 years back, is about addressing those customer pain points and providing them a holistic solution towards that. So we focus on strategic design, we focus on the design engineering, we focus on project management, and we focus on providing the efficiency improvement and strategic solutions on that. So with that in place, we are sure going to take the end-to-end partner route with our customers and provide them a solution approach rather than just trying to sell a product or a box selling. So I think solution is the way forward. Thank you.
Thank you.
In recent times, what we are seeing in Indian medical devices or Indian hospital market is going more towards turnkey and infrastructure solutions. So, from KLS Martin point of view, we are now more keen in participating in as a turnkey solution provider, as for hospital infrastructure, as a turnkey solution provider. So we want to work with new projects. We want to support them with our technical know-how, planning, designing, and then we want to provide all the solutions what we have. Modular OR is our strength. All the products which go with new projects is our strength. So that's
What are
how we
your
want.
expectations in the country? What are your expectations from the industry in general? From the Indian medical equipment industry or the government or macro?
See, basically, if you look at the government's stance as far as healthcare segment is concerned, they are more keen towards Make in India process. So that's a good initiative, but I believe we need more support from the government. If government has an initiative for Make in India, we need more support in terms of attractive zones, or in terms of how we can bring in foreign investment to make products in India. So this is what we want. I would say better packages from the government, which can attract multinationals to start their manufacturing plants in India.
Given so much R&D happening abroad, do you think India is equipped to become a medical equipment manufacturer?
See, basically, manufacturing is different, research and development different. If you are trying to attract companies with strong R&D in Europe, in US, in Japan, these are the major countries where innovative products come from. We can use the R&D facilities in these countries and design and development from these countries, and the manufacturing can still happen in India. So I don't feel in any way we
I
have to.
got you. So tell us about your plans for the next 1 year.
Yes, Careless Martin basically wants to go more into hospital infrastructure projects. We want to become a project management company from basic medical devices and instrument company. I mean, medical devices and instrument is of course our bread and butter, but then we also want to become a kind of solution providers where even the healthcare industry is benefited with our knowledge and know-how.
Anything else you'd like to add?
I think we are present in this exhibition to meet groups from various healthcare projects where we can discuss our strengths and where we can add value to them, things like that.
How much growth are you expecting in the next 1 year?
Growth in terms of
Turnover, sales turnover.
for Careless Martin.
Generally for the industry and for care.
For industry, the growth, I mean, it's different for various product range. As far as projects are concerned, new projects are concerned, it's growing. I would say we can't fix the growth in a small percentage because the growth is tremendous. The major plus point for the country is the population, and to cater this population, the healthcare facilities have to, the number of beds requirement has to, I would say, not just multiply in normal digits. So it has, there's a tremendous gap, yeah, for expansion. So I would say growth is, there's no limit. Yeah, there's no limit. It's infinite. The growth potential in Indian market, Indian healthcare market is.
And what is the expectation for your company? You must have got a target or must have got an expectation, some plan.
See, basically, we want to grow at a good, I would say, at a good, almost like a 25% growth is our,
How much?
25% growth is our plan year by year. But we also want to explore new opportunities, new opportunities where it could also add. So maybe it can also exceed our plans.
Thank you.
Thank you very much.
Hi, good evening. We are SNG. We are in the space of turnkey solutions. Today, the need of the hour is turnkey because there are so many vendors and specialties that needs to collaborate with each other to give a total solution of healthcare. Our portfolio lies there. We give a total package for the infrastructure part of the healthcare, starting from medical gas pipeline, which is MGPS, ORs, ICUs, critical areas, and then and the total infrastructure. So the hospital administrators or the team could buy their medical equipment and move in. So it gives a total package solution to them, a total collaborated services of all their MEPs, which can be collaborated together at a single point. This is who we are.
Please tell us about how you can, about the tier 2 and tier 3 potential.
It makes a lot of sense in the current scenario because a lot of the upcoming market is the tier 2 and tier 3 cities, and this is where the market lies right now, and these are the players which are not corporate level. They are mid segment or lower segment, starting from 50 to 100 bedded hospitals, and they definitely cannot afford a big giant who could have a separate team of each services. And we can give a total umbrella to cater to these projects, and which is at a very economical level. And it makes a lot of sense for these because 90% of these operators are individual doctors and promoters. It's not a corporate level, and definitely they need a very economical package, and that's where we can help them.
Thank you.
We as an SNG, it's been our 65th year of running business, and we're into hospital turnkey solutions. We started our business with stethoscopes way back in 1953, and today we are into automations of certain product lines. Our prime portfolio is pneumatic tube systems, which cater to all hospital needs for spontaneous logistics. And then we have another vertical which is called automated laundry tube systems, which cater most of the laundries and bio waste for the hospitals. Moving ahead, we do modular operation theaters and turnkey solutions for OTs and ICUs and with furniture. So we have a team of roughly 125 people all across India, and we are catering all major hospitals on pan-India basis.
Hi, my name is Dr. Rohit. I lead the business team for Stasis. Uh, we are a LA Bangalore based healthcare technology startup, and we are into the patient monitoring space. So, in terms of the industry, the medical device industry per se in India is expected to grow at a CAGR of about 16% through 2022. And it's one of the it's poised to be one of the fastest growing in that segment, and I think that reflects on the need for delivering better services in a scenario where there is an obvious demand supply gap. So we have close to about one doctor, or rather India has about 1.5 to 2 beds per thousand population, as opposed to a prescribed requirement by the WHO, which is about 4.5 beds per thousand population. We have a similar gap that exists between supply and demand for both nurses and doctors, who are the primary caregivers for these patients. Now, if we're looking at delivering healthcare on a large scale to a population that's about 1.25 billion, we need to devise technology solutions to bridge that gap effectively. Now, Stasis has a cloud-connected patient monitoring solution that ensures patient safety across hospitals and ensures that vulnerable patients are managed effectively by doctors who are connected remotely to their patients through their smartphones. So what we have is an automated patient monitoring solution that collects and documents data, so it relieves the nurse of any manual process requirement, so it frees up her time to do more directed patient care activities. We then transfer that data to the clinician's smartphone so that no matter where they are, they're able to open up their smartphone, assess their patient's condition, look at the vitals in high resolution, and actually make a clinical decision in a timely fashion. This ensures that even your vulnerable patients outside of the ICU are extremely safe, and we have several partner hospitals in the market today that are using Stasis as their core out of ICU patient safety solution. In addition, we have recently released Stasis Smart Alert System, which is based on our proprietary AI. It is a predictive AI solution that tells clinicians about the conditions of their patient and the likely deterioration 20 minutes prior to a patient deteriorating. So this ensures that clinicians are identifying high-risk patients and providing care in a very timely manner to improve clinical outcomes. At the end of the day, Stasis is looking to increase the number of monitored beds in India, which today stands at about 20% vis-a-vis mature markets, which are about 50%. And we intend to bridge this gap with our technology solution. We are today available in Delhi, Bangalore, Hyderabad, Chennai, and Kerala. And we are looking to expand into other metros like Bombay and Calcutta very soon. We're also looking at exploring tier 2 markets with channel partners. So please feel free to look for us on www.stasislabs.com. Thank you.
Thank you.
The healthcare industry has evolved rapidly over the last 2 decades.
the trend setting changes in the medical fraternity and industry across the world. Now, in the Indian scenario, the ever-growing population has been exerting a tremendous pressure on the medical network and infrastructure in the India, in addition to the other factors. Also, the perception of patient care has been changed. Uh, we can say it has undergone a sea change over these years, and the patient care has become more individualized and calibrated. So, government policies assured development in these, in also the advancing technology has redefined the pace of this industry. Now, we, Medimec Industries, the representing the important segment of this industry, that is medical furniture, we strive to provide, supply and export the hospital furniture, which is in both ways, the patient care as well as the utility care furniture. And in doing so, with patient-friendly products, we are striving for environment-friendly also. So at some places we have come up with almost no wood hospital furniture. We at Medimec, with our experienced design team, production team and efficient marketing team, we cater to the variety of segments of hospital industry with our innovative products. Thank you.
So, our company is a hospital healthcare consultancy, and we are into providing the healthcare consultancy to the hospitals. Whosoever wants to come up with a new hospital of any type, any size, any specialty across India. Since healthcare in India is a very developing segment, and different specialties and different type of hospital infrastructures are required to cater the people at different locations. So we are here just to make the things approachable to everybody, so that better infrastructure will come in future, and it will directly affect the costing, because ultimately the patient is the person who has to pay for it. Already in India, almost 95,000 hospitals plus are there, but very few hospitals are really complying to the different guidelines of NABH, AERB, or maybe the other things. So we are just trying to make it up to the mark. So it is only the effort, so that the resources of the people can be invested in the right direction. Most of the time, the difference in between the right infrastructure and wrong infrastructure is very thin. So we are just trying to make it up to the mark, more affordable, and we are more approachable to everybody, since we are even doing the projects in the remote areas in India. So there are so many people in the urban area who are having all the affordability, but in urban, apart from urban area and remote area, there is a huge possibility where we are there to present ourselves with our skills, manpower, and different.
How large is the addressable market? How
In India itself is very big, so quite of course.
are you able to quantify it?
Generally, the size required according to the various guidelines, there should be 3 beds on every 1,000 population. So already in India, it is a huge gap. So we are just trying to patch it up so that everybody will get the quality care.
Anything else you'd like to add?
Uh,
Or which are the projects you executed in the last 1 year?
We have executed so many projects across India. Like in Mizoram, we have done 120-bedded hospital, that is in private sector, one of the biggest hospital in whole Mizoram, that is in Aizawl, the capital of Mizoram. The name of the hospital is Ebenezer, mainly promoted by Dr. Shyama. So it is the quality care. The other hospital is we are making Patliputra Hospital in Dhanbad, Jharkhand. The other one, we are making the Life Care Hospital in Bangalore. It is a maternity hospital and women care. Uh, and then we are making one hospital AWS, that is Adivasi Welfare Society. For them, we are making again in Jamshedpur, that is in Jharkhand. We are making a hospital in Madurai, that is a 300 bed super specialty psychiatric care hospital. So it will be only for the psychiatric care. So we are providing the complete range of hospitals in terms of consulting. So things are going on. It's a big market, and I hope we will serve everybody with a better scenario.
Thank you very much. Thank you.
Expectations from the Indian market. That's the first query.
Please, speak it.
Yes, many systems actually has certain exposure to the Indian market as we are developing. We notice Indian market is very price conscious. So there's a lot of comparisons and analysis done with other products and vendors. There's comparison done with different features and configurations from foreign products. So what we emphasize to the Indian buyer is greater reliability and performance of our products. There is more emphasis given on service units. And the third thing that we are looking at essentially from the product point of view is we offer 1 year extended warranty on our products. So besides the reliability and performance, the extended warranty goes along. We are also another thing is we are offering features that are more compatible with NABH compliance. The Indian market is looking for NABH approvals, so we are offering features that companies and hospital setups are looking for NABH compliance. They prefer our products because we meet and fulfill accreditation standards like ISO, NABH, JCI norms. They prefer such products. Another area that we are looking at is that the Indian market finds products that are made in India that are easier to service, have lower operation and maintenance costs. So these are factors that the marketplace is looking for instead of foreign manufacturers who come in and are unable to give some services. So that answers the first query.
Thank you.
Our company's plans for the next 1 year. These include fulfilling advanced features that will further meet NABH compliances in the future and accreditation standards like those of ISO and JCI. And the second area that we are looking at is to have more offices and distributors, especially for Tier 2 and Tier 3 cities. At the moment, Medi Systems has completed 550 installations in over 50,000 beds all over the country, and we are a major manufacturer of products like nurse support and bed and panels. So we would like to expand our healthcare setups to Tier 2 cities, towns and rural areas where we feel healthcare needs to improve. We need to improve on our bed to patient population that's now at 0.7 per thousand. So we need to go to a higher ratio, the global average of 3.0 per thousand. So we are focusing on better quality, more reliable infrastructure for bed count. And yes, we are looking at improved health ratios, especially in India, maternal mortality, other indicators like life expectancy, birth rates, death rates. So we would like that these ratios improve.
Okay, first of all, we like to represent that we are from Global Solutions, and I'm taking care of the sales and marketing part for the company Global Solution. We are representing the brands for laundry and CSSD in India, and this is one of my partners. He's also the business head for the same company.
and we are here at the HPI 2018 and representing two of the major brands that is coming up in a big way in India. Majorly, we are covering out the CSSD part and the laundry part for the hospitals. They are into infection control, and this is one of those areas where we work for cleaning out the infection. That is one of the major hazard as of now. So yes, you can continue now.
Okay, so talking about the industry, I think there's a lot of things which need to be done for the industry. Right now, what we feel is, because we've been working with, especially in the CSSD and laundry, still there is no standards protocols which have been set up. So we need to, have those certain standards which, which can create those benchmark for the hospital, where there is a standardization for everything. Let's say, for example, we talk about CSSD, right? If you talk about normal today hospitals across the globe in India, there's no other pattern which has been used, to control the infection control. So we are going to create that. We want that industry should have certain standards which are able to, where we create those standards which would help us in the infection control and hygiene standards for the CSSD. Similarly, we should go for the laundry as well. So if we go with these things, these parameters, I think we'll have a better approach. The people in the healthcare also would have been the advantage where they would be able to have the better savings, preventive measurement and all. So I think this is one of the part which we need to understand. That is one.
What is there is as on date is like a patient actually walks out to any of the hospital. He looks at the exteriors and the interiors of the hospital, but what actually he wants a more hygiene and more actually comfort over that he's getting out the results for whatever problem that he's coming up with the hospital. Now the hospital is again there's a if we bifurcate hospital into two parts, there's a part that is being observed and being visible to the patient, but there's a external there's a different part that is where we are actually working out, that is the CSSD and the laundry. CSSD is those area where the department which is actually making out a or helping out to the surgeons to carry out their surgeries and all. And definitely, if there is a lack of infection on the instruments and all, it would be very beneficial and helpful for the control of HAI, that is the hospital acquired infection. So we have been working truly for that and controlling out the HAI. That is one of the biggest threat as of now on earth. That's all.
What is your expectation from your company for the next 1 year?
We are expecting that we are able to set or make the standards for this healthcare industry, where we try to educate the government people and even the private doctors and all. See, if you talk about today government, the basic problem what we feel is today anybody coming to a government hospital, he goes there and because of these hospital acquired infections and all, he is staying, let's say he has to stay for 3 days. So because of these infections and not able to prevent that, you are able to spend 3 more days. So what the government is losing the money on expenditure of.
I would go a step further and say people who can afford it. The best surgeons are here, but they are going overseas only because of hospital acquired infection. I know so many cases of that. So many cases I can tell you. But the surgeons are better, the competence is better, and yet they are going to Singapore or UK or whatever.
The mindset has to change. Actually, that mindset, once see today if you talk about even the CSSD and laundry, they have been treated as like the cost center. But they are actually not the cost center. They are basically the profitability center, because the one day if CSSD or laundry is not working, it is going to have lakhs of losses for the hospital. In terms of whether not able to do the OTs, whether we are not able to maintain those standards for the linen. Today, if you talk about linen, 80% contamination is because of the linen in the hospital. So if we don't stop this, I think we are not landing anywhere.
What are your expectations re-turnover? I mean, in figures, in statistics, let's say. How much growth? What are your expectations for the company
See, we are looking at almost like 150 to 200% in the next 1 year. That is the growth we are looking at.
I tell you why we chose about these brands is because these are IP based brands. Now what we are emphasizing is lack of manpower and putting emphasis on the technology. These machines are technology based.
So what are the brands you are representing?
The DGM is from Switzerland, that is for the CSSD, and Fagor is from Spain, that is for the laundry. Why we are emphasizing on these brands are because they have been IP based. Now once we have given the entire responsibility on the technology, definitely there would be people who would be monitoring these things, but there is no hamperness or there is no bypassing the things. So every stage has to be cleared, and that is again it's proven technology, and it's a European brand. So we meet out all the international standards about these brands and all, and that's what we are doing. Now, if we follow out the entire protocol, definitely it will be it will the patient who is using or who has been actually treated out would be would not be having any problems about the HAI and all. That's what we are.
How large in value is the infection control systems industry in India?
If I talk about infection control, it's not only India. Worldwide is the major threat as of now. If
No,
I talk,
in crores, how large is the market in India?
if you can say about any of the hospitals in India, if I talk about even the government or the private hospitals, almost around 80% don't emphasize on proving out.
So today, how large is the market?
If you talk about in terms of the large, I think it's even more than 1 lakh crore market for the
Which
infection
we already
control.
have. We already have infection control systems of 1 lakh crore in India today.
In they have the market size.
The potential. That's
Yes,
the potential
we are talking about.
But how much is the market size today?
I think it's negligible. Only 5 to 10%
we
of that
have
which
to
are focused
really
on that.
start up as
So
of
the
now.
addressable market is 1 lakh.
Yes, there's a huge market which need to be addressed on that, and I think the upcoming future for India is to control these, infection control and hygiene standards. The more we go into that, I think we will have a better India in terms of the healthcare segment.
It's not only government or the private. Every hospital actually requires it.
Plus, also we would like to emphasize on that the guidelines which have been created by NABH and all, it has to be more stringent. It has to be advanced as per the the new process. I think JCI is doing a wonderful job in that. So we would if we are looking at that standard only where JCI is doing, we should be able to do that with NABH also. We will have a more focus on that.
Thanks a lot. Thank you so much.
Thanks for your time.
Bigger number of people. India is a huge population. Not everybody falls the same strata. So we're looking at providing healthcare schemes to the masses as well. Most of the countries abroad have universal healthcare schemes. So something like that could be implemented in India. Also, rupee has depreciated, which makes import for medical equipment a lot more difficult and a lot more expensive. So something on that we could look at. Let's look at what we do. For Praxis, we are into consulting. We do hospital planning and management projects from concept to commissioning. We're a division of Japan Industries based out of Mumbai. Our projects are all over India, pan-India. We operate in Gulf, in Africa, in Sri Lanka. We're now diversifying into also Praxis Med Suites, where we're offering, the next thing is medical co-working, medical workspace. We've been seeing a lot of office workspace. Now let's look at medical workspace. So of course initially the concept of polyclinics has been around, but now we're looking at providing complete marketing and operational support to the doctors. So the doctors can now focus on their clinical work and leave the entire operations and marketing to us. Because today there's a lot of demand for marketing. Marketing has become a big thing for doctors as well. Maybe subtle marketing, maybe different forms of marketing. So leave all of those things to that's our focus. We're into consulting it. We take care of all of those things, and you can come and practice at our entire fabulous setup, which is available to you at Juhu, and at 4,000 square feet available space for medical co-working space with diagnostics. Apart from that, we've been providing a lot of consulting opportunities. We've been making hospitals pan-India. We've been planning them, getting them started, operating, managing them all across India, Gulf, Sri Lanka and Africa. We hope to continue doing the same. Thank you so much.
Some turnover, some growth you can talk about. There's so many. What is the value of turnover? What is the expectation?
Well, I'd say it's not been that. We've not been increasing last couple of years after the demonetization. So it's gone. I wouldn't say it's been leaps and bounds.
Perfect. Thanks, Atan.
Thank you so much.
So, medical industry, of course, is geared for a change now. And earlier, we used to see that everything what we get was an old technology. And if its specifications are embedded as per the old technology, especially the government institutes, they will keep on replicating that, particularly in the tenders. And the repetition was very, very prevalent in our industry. And I will particularly talk about the hospital theatre, which we call it as a clean room sector. And everywhere I think I am in this OT fabrication for last 3 years. Earlier we were for the last 30 years in medical equipment and devices. The hospital market is now geared for a change. We have been meeting with various government authorities. We are trying to introduce the new technology. And having said that, a lot of funds are going in now for change. What earlier was for the medical industry, now everything is changing, and I would say the government is pushing a lot of funds for that change. Having said so, we have brought in the new technology in India in making clean rooms. When we talk about clean rooms, we are talking about operation theatres, ICUs, isolation wards, in which the first specification of making of an operation theatre is antimicrobial walls. So the material which we have brought in India is, we are importing it from outside. The first thing is, it has got a lifetime warranty of it being antimicrobial. So this part is of high interest to our industry sector, hospital sector, and having said that, all newer hospitals and also the hospitals who are changing, big corporate groups like Apollo Group, they are all Kokila brand over here. Government sector like KEM, like LTMG, they are going in for renovations. And wherever there are renovations, we are putting our new technology, which has lifetime warranty of it being antimicrobial, and other features which are accepted as an NABH norm in the industry. So
This technology is from where, which country, or which somebody
So,
associated?
so its main plant is in Israel, but yes, it has got other plants in America, in Germany, and in the UK also. And it is very widely accepted. Earlier, what was a brain set of our industry was what is there prevalent is going to be used again and again. But now I think not only our private sector, even our government sector is geared for change, and that is where our success lies.
How price competitive are you? How
I
expensive?
would say what earlier was used, we are much more economical and worth its penny, more long lasting, and as I said, it's very suitable for any clean room environment throughout India, anywhere.
This is in the OT.
Not only in OT, in any place where infection is a concern. So it can be an OT, it can be an ICU, it can be a ward, it can be isolation ward, sterile passages.
All the private rooms.
Or the private rooms.
The entire hospital.
Entire hospital. So this material, we to economize it further, we have brought it in two formats. One is with the silver ions. Silver ions is a bit more expensive. We can use it in more sensitive places where infection is of primary concern. And then the same material is used in other areas without silver ions. So we have two sets of material in all colors, in all formats. You can digitally print it and liven up the place. So it's a cladding material for the entire hospital sector.
And how much success have you had yet?
Very much. We must have done more than 350 to 400 just the operation
So
theatres in last 2.5 years.
Start.
And that is why when I entered into this market last 2-3 years making OT fabrication, people were little resilient in that. But I think the mood set has changed. There is no extra money being spent on using this material, but a lot of benefit in that. It is moisture resistant, easy to clean, antimicrobial, fire retardant, chemical resistant, lot of colors, easy to maintain. So whatever is required in this cladding material for hospital, it's present.
So how much additional? Is it a very expensive? How much additional expense is it?
Not at all. Not at all. Very economic and long lasting. Like government asks for a 5-year warranty on any material which goes into the government tenders. We give a 10-year warranty on that. So it's totally impact resistant.
And is there a lot of competition in India? Is it already in a...
I would say that I am lucky I am leading the market as yet.
But the smaller people have come in, have they started?
In outside India, in the world, there are a couple of more manufacturers, but I have been fortunate to enter this market a little ahead of all this, so I'm leading the market in this.
Thank you very much. Thanks a lot. Thank you so much. Yes.
Hey, hello. With regards to the patient health solution, basically what we see here in our country, especially in India, it has a very, very long way to go because right now we are getting things to be digitalized in the need for the hour, which is digitalization. Uh, this has a very big way, and we are just starting on this part. When it comes to our product, what we do, we help hospitals, clinics, and practices to cater their service across globe through telemedicine. And the way how we do it is through a white labeled telemedicine platform, which also has a clinical ability of managing the OPDs. So the solution is simple, which makes the patient to get their care on the go. The continuity of care is being provided all the time, every time, and the practitioners at the same time make themselves make their privacy, because it's not being their mobile numbers are not being shared, or their personal data are not being shared. At the same time, at the same token, they also keep providing the service all the time, every time. So that's where we are from.
Thank you.